Good morning. These lights are, by far, they've harnessed the sun.
Yes, they are very bright.
Yeah, they are. Good morning, everyone. You guys look. This is really, really strong, but you guys look pretty serious. There are a few rules to this gig today. We can't be serious because it makes it awkward for me, and I can't get the message across to you. And you've got to ask me questions at the end. So that's sort of how we're going to do this thing today, if that's all right. Yeah. I've got an awkward.
Can you say near close to the mic as well? People are filming it as well.
Yeah. This is right. Can you hear me? Can you hear me without the mic as well? All right. I've just got to test that. I'm not sure if you guys can get my bit up on the screen. Is that all right? So while we do that, I'll tell you a bit about me. I've got a very strange job in the NHS. So it says Colchester Hospital here, but I work with over 5 or 6 organisations simultaneously, and the issue is I only get called in when things are not working with numbers. So I don't get to go in and put really nice systems in place, and I don't get loads of time, and I don't get all of that. I just go in, and I've got a very small window to fix it. And if I can't fix it, then, well, it's a bit awkward. So, are you guys good? And that makes it pretty difficult to sort of have the opportunity to think about the right solutions and how that might work and all that sort of stuff. So without this, there we go. We got it. Let me just try this. Good. Right. So I can't promise I'll stay beside this mic because it makes it hard for me to do this. Okay? So I'll try to point here. So most of this presentation is about this chap, Herman. And he came up with this ink block test, the perception test. So I thought I'd ask my niece, what did she sort of see when she looked at this? And you guys might have a different view, but she said she saw a scary bunny rabbit with a massive tooth. And I see something completely different. I see sort of a coat of arms with 2 elephants at the side. But that sort of defines a lot of the challenges that organizations have got. So if you follow me through this journey, 1,000 BC ago, this is how we dated. So Chappos went out with the old clubber, not that was the right thing to do, and that happened, and that was dating. In the 80s, we got a bit clever. And we brought out the old mixtapes, and that catapulted us into a different arena. So we sort of made a lot of headroom there. And then we're in this era now, sort of predominantly a lot of sort of big data is harnessed and allow people to date in that way. However, if you look at health, we've not really evolved with that sort of normal way of doing things. And that's pretty awkward. So if you can imagine, the people who work in hospitals are the same people who live in that world, but the technology hasn't sort of followed across in terms of big data, which is difficult. However, going back to Herman's sort of ink blot test, you've got, in most organizations, you've got sort of 3 strands of people. So you've got your corporate functions, you've got your clinicians, and you've got your nursing body, as it were. And each of these people interpret sort of big data in a very different way. So executives or administrators of hospital will sort of really gravitate to numbers, and they'll be excited about big data and that sort of stuff. And then you've got surgeons who will, or clinicians who will immediately compete with each other on big data. And then you've got the nursing body who, they've not, that's never been a big part of their training. So I was with an executive last night, and he's a sort of an executive workforce. And they've got a problem. So I'm there to talk about this problem. And he said, Orlando, when I did my my MBA, we didn't get we weren't told that we needed to run hospitals based on understanding how numbers work and how things are flowing. So this is not my bag. So can you have this bag and let's sort it out? But I think the same is true for nurses. So they've not had that sort of engagement with numbers. So this is completely new, completely different to them. So if we keep that as a start of a 10 in mind, this is the story about this particular hospital. So 2-3 years ago, they were in a lot of distress. So they had no visibility around numbers, lack of an understanding of those numbers. They were a poor performing organization, and there was a lot of risk. And I was sort of invited there to sort this numbers issue. Now, what the organization was very clear on is what they wanted. So they started with a sort of a hunger to de-risk the organization. They wanted to do something or to have a technology that would allow them to innovate. So not just sort of your box standard delivery. They wanted to transform the way they looked at big data or analytics, empower the business, drive up performance, and all of the other things there. And I remember we engaged a number of vendors at that time to sort of figure out how it would work, and we did get someone in. However, sort of 18 months on, it still didn't do what we wanted it to do. So we got another kit in, and we got these people in, ClickView, and what their technology lent itself to was or is something that I think it doesn't matter which bit of which kit you get. The issue is the same in that I can almost guarantee you that probably 100% of the people in this room would have not been trained on how to use that bar that Google has got. So no one's sat you down and given you a tutorial on Google. You sort of just get up and you go on and it works. And given the issue around the theory from Herman in that the nurses wouldn't easily get numbers, and you've got to sort of bring them in that journey, we needed to have something that almost acted as Google, so you can Google your own data, because then you can probably ask some of the very basic questions that you've got of it, and you might get really, really solid answers. So we took a proposal to the executive team, and it's based on these are the things that we think this kit brings to the party. Since then, I think for the first time in history, this organization has managed to hit all of its sort of cancer or oncology standards, which means that the regulators, so Monitor, who regulates foundation trusts, they've got a rating system that says these are the things that you've got to hit all the time, and cancer care is one of those things. And for the first time in history, with visibility around the intelligence, they've managed to do that. In terms of the approach, and I know I've just got 15 minutes, so I'm just trying to jump through things so that you guys get the core bits. In terms of the approach that we took to do it, it's very simple. So most organizations that I go in, they've already got some sort of reporting or some sort of system to manage big data. And what you want to do is almost replicate things that people recognize, so that it's easy for them to get on a journey with you. You don't want to do something that's too dissimilar to what they know. So as a start of a 10, that's one of the big things that we were very keen on ensuring happened, replicate good practice. In terms of how we built things for the organization, I was speaking to one of the biggest hospitals in the country last week, and the chief operating officer said to me, we need a warehouse in and we need this technology in. However, what I don't really care about is how the warehouse is structured and how all of that jazz works. So I don't really care about the back end stuff. All I want is to know that the front end looks really snazzy, and it does what it should do. And that's a sort of a lesson I've learned over the years. So strong aesthetics is something that we've got almost a graphic designer in to design every application so that it looks and feels not like a hard bit of kit, but really soft and going back to the online stuff, it feels a bit like that. In terms of the other things that we needed to do, so a lot of organizations, and I'm just not running through these in order, but a lot of organizations will get a bit of technology and to manage big data, and they will assume that people gravitate to numbers. So, I mean, I'm not like the uber numbers man, but I don't wake up every morning and think, you know what, I'm going to go look at some numbers. That will get me through this day. And I don't think a lot of people do. So getting a kit in and leaving it then expecting people to gravitate to it, I think there is no value there. So what we had to do was create a bit of a community. So almost an internal market which allows people to feel that they belong to something, and that there's this sort of buzz around whatever it is the technology is that manages big data. What we needed as an organization was sort of, again, going back to that theme of people gravitating it. You need someone at a senior level who drives a lot of this forward. And you know, I play a big part in that. But I think what we've got, which is different from most organizations, we've got our chief exec who, you know, every single week he looks at a suite of indicators and he sort of writes bits about, you know, this is where we are, that's where we, and he uses data in that way to drive things forward. So I think having someone at the top of the tree, as it were, to drive that is pretty important. In terms of, I can't remember your name, Alan. What Alan was saying is, you know, be bold. Don't sort of, I suppose, delay things that need to be done and try to sort of get everything perfect. So that's one of the things that as an organisation we have had to do. So we've had to be bold, and some of the things we've got wrong. So we've got probably, I would say, 5% of the things that we've tried to do wrong. But you know, is it cataclysmic? I think not. And that's a big part of why we have been, I think, fairly successful with big data in hospitals. In terms of innovation, we've not stopped at any point in terms of trying to innovate. So most organizations will put in a suite of indicators that they have got to report nationally on. So cancer, 18 weeks, A&E, and a suite of things. However, what we've used the technology to do and how we've managed big data in that way is that we've almost looked at sort of a bit more than just reporting the box standard bits, but we've looked at sort of predictive analysis and how do we sort of almost replicate. So, for instance, there's a standard which is patients should be treated within 62 days of on a certain pathway, within being referred to hospital. And for us, what we wanted to do was we wanted to bring that back internally to help patients, to help a better sort of delivery of care. So we've brought that back to 48 days. And it's almost a new standard in its own right. But it allows us to do that with the data and allows us to sort of cascade that across the organization. So that works really well for us. I'll skip this slide. We sort of talked about that because I'm just conscious of time and working through all of these slides. So in terms of our roadmap, as it were, and this is sort of a bit outdated, but it gives you a sense of where we started. One of the things that not only for this organization, but for every organization I work with, is pretty key, is getting as much as you possibly can get to the front line fairly rapidly. So these applications might just look like words and they, you know, might look fairly small, but they are extremely complex to build accurately. And what we've had to do is, you know, I think we've been one of the fastest deployment in terms of big data technology in the NHS. Period. Because what we've managed to do is we've managed to use the technology to rapidly deploy things that people across the organization never had visibility of. So there's this one surgeon. He came to see me last year, and he's been working in this hospital for 20-something years, and he's never had. So he's operated on thousands of patients, hip replacements, knee replacements, all sorts, and he's never had a visibility of all of those patients on one, in one platform, or he's never been able to interact with those numbers ever. And when I showed him the data in technology and said, you know what, you can click down on, or you can drill down on this, and this is what you've treated as, or this is what the procedure was that you sort of did on these patients, and this is the outcome. He sort of turned my laptop around, and he sort of looked behind, and he goes to me, Orlando, what the hell is this? This is black magic. But for me, that was sort of. There's a lot of things that I've done around big data, but that moment made me feel that it was making a difference to the people at the front line. And I think this just gives us a sense of sort of how we've done it. So we started with cancer, we rolled out A&E, mortality, outpatient, so understanding those clinics and readmissions and that sort of stuff. But for the first time in history of that organization, they've had full visibility of their data, and it's a lot of it, but what we've tried to do is sort of present it back to them in a way that works for them. I'll skip this as well, if you don't mind. So I think my 15 minutes is sort of almost getting close to an end. I suppose this slide, so most technology that we've had before, it doesn't, going back to the graphic design thing, it doesn't come with any sort of pretty bits on it. It just comes as a kit. And what we've done with the technology that we've got is we've sort of almost rebranded every single application so that it looks like, it's not the best app store in the world, but it looks sort of like an app store. And people can tell what applications are what, but it's got the same look and feel to things so that it's easy for them to go through. Because even with if you go back to the Google example, you've got two buttons there, the search button, and then you've got I'm feeling lucky, I think. I've never really clicked on that one, and every time I do this talk, I always say I'll click on it and I forget. But I don't know what that button does, but I suppose that the principle on which it operates is that it's consistent and everything looks and feels the same all the time. So we've tried to replicate that in the applications, and that seems to work for the organization. This bit is not. It's just a way of doing things differently. So going back to the issue of people not gravitating to numbers. So, every day I've got to grapple with how do you embed technology even further into the organization to every single member of staff. So that bit, I probably don't think about numbers every day, but that I think about every single day. Because every single day I've got, starting at 9, I've got half an hour conference calls with several different organizations all the way up till 11 o'clock. And the issues are exactly the same on almost every conference call. And because of governance, we can't pull everyone together. But this, in terms of embedding technology, is sort of a big part of it. And what I thought might work is, so what we've done is we've taken a screenshot of an application and its performance, and we've embedded in that screenshot a bookmark. Because I know that most people, once they get an email, they probably will either delete it or they'll just click really quickly and then delete it. So once they click on the email, it then takes them to the application. What we've noticed is after they click on the application, they then click 2 or 3 times on other tabs or other things within that application. And it sort of tricks them to start discovering or engaging with big data. But for us, I think we're one of the only organizations where we've got 10% of the organization, which is a lot of staff, actively every single day using the intelligence to drive up performance and better outcomes and that sort of stuff. So this has gone, I think, if anything, this is a quarter of our silver bullet in terms of getting it in there. And I think he's given me this behind there, so I've got to wrap it up. Those are if anything I would leave you with, those are the 2 things. I'll keep it really simple because most people will get get simple things, but also treat it like a business in its own right within the organization, not as we've just installed this while we've got our as a sort of a vendor, we've got our Wonga, or as a sort of, well, someone who puts it in, we've just put it in an asset. And I think that would be what it is for me.